Good morning. My name is Tyagi from Group 385, course General Medicine and subject of Clinical Practice. Today I'll be showing you the administration of the infusion, intravenous infusion of the drugs. I have all the things that are needed for demonstration of the drug. I'll be using the NS here. I have an infusion set with me. I have here with me this scalp vein set and the separate needle that I'll be showing the use of later. Firstly, we need to wash our hands for keeping the procedure hygienic. This will be done on the basis of the European method of washing our hands. Firstly, the palm to palm, between the fingers, back of the fingers, and back of the thumb, tip of the fingers, wrist. And we are done with washing our hands. Then we need to wear our gloves. As we are done wearing our gloves, we need to first set up the solution. Ideally, this needs to be on the stand, and there is a hook for keeping it on the stand. This needs to be like this. We'll uncap it. Then we'll get the infusion set and use the spike part. First, let me describe all the parts of the infusion set. I have spike, chamber, that there is filter, then we have regulator, then this is the needle. Ideally, this is 21G needle. So we will uncap the spike part of the infusion set. We'll insert it like this. Make sure the regulator is closed. Let me show you how to close the regulator. Regulator needs to be closed in the closed position. Then as this will be this will be hanging on this on the stand, we need to make sure the puncture on the skin is done. We will put it aside for now. I have scalp vein set here. Ideally, we can do the puncture on the skin on the palm area of on the back side of the palm area here. We need to hold it like this. Remove the cap, and as we all know by now, we need to make the intravenous puncture. How we will do that? bind the tourniquet on the upper part of the hand so that the veins can swell up and become more visible, and we will pull the skin longitudinally so as to make the veins stable. Then as I pull the skin backwards, I will use the scalp vein set here on the 35 degree ideally for reaching the vein. As you reach the vein, you will be able to see the blood in this. So for stopping that, you make sure that this here should stay closed. The other side of the scalp vein set should be closed. We will as I punctured here, as you can see in the intravenously, we will be able to recognize it by the blood in the tube here. We will make sure with the help of the tape, surgical tapes, that it stays stable. I'm sorry, I do not have that available with me, but we need to make the tape one over here, one over here, one over here, and one underneath the set for making the scalp vein set stable. Then next, what we need to make sure is that the IV set that I have already set up with the spike inside the NS solution, and as you can see, there is a little bit of the drug inside the chamber of the IV set. There we have the needle. Right now we do not have the use of the needle, as I have already set up the scalp vein set on the skin. We will remove the needle, and we will slowly open the regulator for checking the water. The drugs needs to be in the tube, and no amount of air should not be available. As I open the regulator, as you can see, the air is coming out of it. Yes, at this point we need to close close the regulator again and open the scalp vein set other end, and put it like this, and you can gradually open the regulator so as to allow the drug to pass. We will open the regulator by pushing it on the bigger side of the regulator. As you open it, you can see here let me show you what you will be seeing here. You will be able to see the drops going in the chamber of the IV set. You need to administer in short interval of the time if the patient is getting the fluid gradually or not. Too much speed of the infusion of the fluid can lead to too much speed of the infusion can lead to the general hypothermic symptoms of the skin. So you need to make sure the infusion speed should be gradual and controlled. Then we can remove our gloves upon the procedure. and we are done here. Thank you. After administering the procedure, we need to make sure the garbage should be disposed of in the proper manner. The plastics should be disposed of in the group A bin, dustbin, and the syringe and the needles need to be disposed of in the group B dustbin. Thank you.